important hearing. And first of all, I want to thank our hosts here from West Sacramento. They have been absolutely wonderful. The city and the staff and elected officials have been so helpful in arranging this hearing, so thank you so very much. I also want to give a special welcome to my friend, my dear friend, Congressman Mike Thompson, who is, his district is west of us, and quite frankly, it's really nice to have him here. So welcome to West Sacramento, Mike. Thank you for being here today. You know, I think all of you know, but I want to emphasize the gravity of the moment that we're in. Speaking up in the face of adversity is really not easy. We all know that. So a sincere thank you for the panelists who are here today. Thank you for stepping up and also serving the people that I know you represent also. Now, over the last few weeks, Congressman Thompson and I have fought back tooth and nail against the Republicans' big, ugly bill, because we know how it would affect our constituents, our everyday people in our communities. And meanwhile, our Republican colleagues have really been pushing their extreme agenda under the cover of darkness. They released the text of the budget reconciliation bill in the House in the middle of the night. They jammed it through committee in the middle of the night. In fact, just a few weeks ago, the Energy and Commerce Committee, on which I serve, debated the bill for 26 and a half hours straight, around the clock. And the interesting thing was, our bill had 4 parts to it, the Energy and Commerce bill, and they waited until 1 o'clock in the morning to bring up, of course, the biggest part of the bill, the Medicaid part. But listen, we all stood up, colleagues and I, and we stayed up all night making all kinds of amendments so they would have to take votes on them. We told the story about our constituents and how Medicaid cuts would really affect them, whose lives really depend upon not only their lives but their families' lives. Talking about the impact of slashing critical programs all our communities really depend upon. And one thing is clear, our Republican colleagues were hiding under the cover of darkness because they don't want Americans to see what this bill really has. And really that's why we are here today, to shine a light on the truth, to uplift the voices of our constituents, to ensure our community knows what and who is at stake. And let me just be honest about what's happening. No matter what they say, there is no if about it. Benefits will be cut. $800 billion from Medicaid, $300 billion from SNAP. Rollback of the Inflation Reduction Act, program that had a positive impact on all of us here in this region. Lower costs for prescription drugs, for energy, all these kinds of things that were really important for all of us here. You know, our Republican colleagues can choose to callously push back the facts, but the impact on each of our communities is real and plain to see. This big, ugly bill rips away health care from millions of Americans. That's kids, parents, grandparents, cancer patients, people with disabilities, and so much more. It forces hospitals, emergency medical services, birthing centers, and other care facilities across the country to close. It takes food away from millions of Americans by gutting SNAP, our food assistance program. Over 2/3 of those who will go hungry are kids, older Americans, people with disabilities, and even vets. I could go on. Bottom line, this bill is an all-out assault on American families with permanent consequences. And all of this to pad the pockets of the richest Americans. That's wrong, and that's why we are fighting back the best way we know how, together, united in purpose to protect each other and the least fortunate amongst us. Now, I'd like to pass this on to my friend and colleague, Mike Thompson, for his opening remarks.
Well, Doris, thank you very much, and I too want to thank our friends at West Sacramento. for hosting today and for all the good work you do. And I know, Doris, you know how fortunate you are to represent my old district in West Sacramento. It's a great spot, and I know you care a lot about them, and you do a great job. And I want to thank all the witnesses who were here today, who took time out from their busy schedules to be here, because you know how important this is. And thank you to all of you who are here. Everybody in the audience has a stake in what's happening, so it's important that you hear from all of us as to what we have to look forward to and why it's important that we stop this big ugly bill from going forward. So it's an honor for me to be here, and we know why we're here, we know what's at stake, but the truth of the matter is this effort by our Republican colleagues is just shameful. It's shameful and it's hurtful. And this month they passed the bill, as Doris pointed out, in the middle of the night. You did the 26-hour hearing. The committee that I'm on, Ways and Means, has jurisdiction on this. We were 17 and a half hours, and then I got to double back and be on the Rules Committee, and then I think I waited 12 hours or something. I had 2 amendments trying to take out some of the bad stuff that they put in this bill, but it has in fact been an attack on our government, attack on taxpayers, attack on the people that we represent, as Doris said, to provide a tax cut to literally the richest people in the country. And it's a community of people who don't need the help. They don't need a tax cut in this particular environment. And sadly, they're paying for this in part by taking health care away from 14 million Americans, cutting food security programs that serve about 11 million hungry people, and eliminating all of the green energy work that we did in the Inflation Reduction Act. And that's real personal for me, because that was my legislation. And it's been very, very beneficial. 93% of all new energy since 2020 has come from solar, wind, and batteries. That legislation in the Inflation Reduction Act is responsible for 400,000 U.S. jobs and an investment of about $400 billion. And energy is a real short commodity right now. We need it, and demand is even getting greater. With the expansion of Bitcoin and AI, the need for energy is literally off the charts. And so what this does is it hurts our ability to deliver on those energy needs, and it advantages one of our main competitors, China, in this effort to lead the renewable energy sector. And again, it's just shameful. And I hope, Professor, that you're able to talk about the language that got stuck in the last minute that weakens the federal court's ability to enforce court orders against this administration. That too is shameful. So bottom line, this is a bad deal for the American people. Tax breaks for billionaires come at the expense of real lives of our constituents, our friends, our neighbors, family members, people who are going to lose health care, nutrition services, and they're going to see their energy costs rise. All estimations today is by about $110. And anytime you just strip critical services from the American people, it's just bad policy, and we shouldn't be doing it. And we heard throughout the debate about how, and throughout the campaign, quite honestly, about how important it was to get a handle on debt, that our national debt is over the charts. These guys were against growing the debt up until they voted for this bill, because this bill is going to add about $5 trillion to our national debt. I think the number's 4 and change, But when you add interest rates to that, and as you know, our credit rating has been lowered, so the interest rates are even higher now. So when you add the interest rates to this, it's about $5 trillion. And it's pretty clear this isn't a big, beautiful bill, as Doris said, it's a big, ugly bill. And I want to get away from this idea that, Democrats are, tax and spend. Between the Bush administration and their 2 tax cuts and the first Trump administration and his first big tax cut that added $1.2 trillion to the debt, the total amount right now, before this is added, is $10 trillion. So they've added $10 trillion to the national debt and then claim that they're here to help reduce the national debt. It's like, the arsonist being the firefighter.
Sorry.
No pun. So the Senate's going to take this bill up, and that's why it's important for us to make sure everybody knows about it. Because unless you stayed up for around the clock for 3 days, you weren't watching this stuff. As it's already been said, much of what was debated and many of the amendments that we tried to do to the original bill, the language was changed at the last minute. So they heard the debate, they heard the amendments, they killed all of the amendments, and then they substituted another amendment for the underlying bill. So it changed even after all that around the clock work. And the fact of the matter is, the more people know about this, the more they know it's bad for the American people. And there was an article that came across my phone this morning, and it was, quote, the headline was, quote, GOP runs into voter buzzsaw of criticism on Trump's big, beautiful bill. So getting the message out in the court of public opinion is important, and it's working. So I thank you all for being here. Thanks again to the witnesses. Doris, thank you for partnering on this. This is important stuff, and I yield back.
Thank you very much, Mike, for your introductions. And I'd like to invite Dr. Darian Shinshansky, right?
Yes.
The Martin Luther King Jr., Professor of Law at UC Davis Law School, to give his opening remarks.
Can you hear me? Yes? Okay, great. Thank you so much. It's a great honor to be here. Talk a little bit about this bill in general and a few riveting specifics. This is a reverse Robin Hood bill. It takes lots of money from the poor to give to the rich. To be concrete, the tax portion of this bill makes the lowest 40% of income earners poorer, helps the middle quintile a little, and helps the highest income earners a lot. More than $20,000 a lot, starting for the top 5%. And that's before the tariffs. So those 2 middle quintiles are probably going to be net losers once the tariffs are factored in. In addition, this bill adds to the deficit, $4 or $5 trillion over 10 years. And so it's also reverse Robin Hood as to future generations. Perhaps the future will thank us, but that's doubtful because all this money is only projected to increase GDP by 0.04% over 10 years. So if they invent a time machine in the future, they will not send us back flowers, but probably they won't because of the cuts to basic science research. So it's kind of a genius there. Okay, so there's much in this bill. Incompetence, malevolence, petulance, and occasionally soaring mediocrity. Sometimes it achieves all these goals at once, which is a kind of beauty. Okay, so consider a particularly expensive item, the extension and increase of the so-called pass-through deduction. This provision will cost about $800 billion, so basically the same as the cuts to Medicaid, and more than twice as much as the cuts to the SNAP program. So it is a very expensive tax cut. In terms of distributional impact, this tax provision, to use a technical term, is Mr. Burns level regressive. Consider, according to the Tax Policy Center, only 26% of this expenditure went to taxpayers in the bottom 95 percentiles. Okay, of the income distribution. 18% went to the top 5%, and 13% went to the 0.01% of income earners. How can that be? Right? How can a deduction for all people who earn money in the form of a pass-through, so not a corporation, how can it be so regressive? The answer is that it gives the same tax break to people who earn $100,000 as a private equity manager who earns $100 million. And that's how you get these totally crazy numbers. Now that could be changed, right? You could cap it, say this is only for lower income earners, but it's not. And so that's how you get these crazy distributional results. Note that even if you did cap it, this would still be a bizarre policy, because what does it say? It says if you're a self-employed plumber who earns $100,000, you get a tax break. If you're a plumber working for yourself and earn $100,000, this break gives you nothing. Unjustifiable. Totally bizarre. As for mediocrity and incompetence, consider various incentives for private investment. Most of these are not particularly wise because if they're profitable investments, they would have been done anyway by private industry. It's particularly perverse to spend money on these incentives for private investment when there are Doge-inspired cuts to public investment in basic science. So we're essentially cutting public science to pay for private science, which would have been done anyway. It's even more bizarre to the extent that the higher deficit is going to mean the government is going to be competing with private industry in the future for investment, further tamp down private investment. I don't know what exactly a good analogy would be. The best I could come up with would be subsidizing healthy lifestyles by taxing healthy food, right? A combination of policies that is like worse than usefulness. As for malevolence, consider the excise tax on remittances abroad. This and similar anti-migrant provisions do not raise much money on their face, right? They just hurt the weak. They're also foolish because migrants pay, or used to pay, a lot in taxes and don't use a lot in services. So again, just very hard to understand. As for petulance and incompetence and regressivity, consider a final provision that punishes other countries for copying the Trump administration's 2017 tax reform and imposing a minimum tax on very profitable global multinational companies. So other countries in the world, basically every other advanced country in the world, has implemented a version of what the Trump administration did in 2017, making the biggest corporations pay at least a little bit. They didn't do it exactly the way that we did it.
Thank you, Dr. Shonsky.
Yeah, so we're going to retaliate
we
against
will
it.
have
Yes.
other questions
Yeah.
for you as we move along. I'd now like to turn it over to Chief Chris Mastanagna of the Sacramento Fire Department. Chief?
Thank you, Congressman, and good morning, everybody. I'd just like to start out by, I'll circle back to Medicaid, and we do not know today what effects the cuts in Medicaid will have in the fire service. It will have a long-term effect and a short-term effect. People that have no insurance or are left with no way to solve for a simple issue will call for emergency medical services, and it becomes a primary care for them. We have seen this before in my career. In over 30 years, it happens. We are in a good place right now, but these cuts will have a long-term effect as well. The cities and counties around us depend on subsidies from Medicaid to provide emergency medical services. In the city of Sacramento alone, we could be looking at, if it was all gone, a $48 million shortfall just in EMS services. And if you look at across the river in my city, the shortfall we're already facing, this would have a draconian effect in the fire service. It has a draconian effect in public safety because it doesn't just hit the fire department. It hits all of public safety. Other cuts that were talked about are in the FEMA grants program, which just further compounds the problems we have in the fire service. The FEMA grants programs help us staff fire stations, that helps us buy equipment. When your local tax base drops, your sales tax dips, you look to the grants to help get you through the lean times. We're cutting $646 million out of the FEMA grant program. We're talking about moving the Urban Search and Rescue program maybe to the State Department. We don't know. We watch it on the daily. It's a big program. There's 6,000 first responders, doctors, engineers, firefighters in this program, and it runs on about $42 million a year. And these are the people that go to 9/11, Oklahoma City, Katrina. We respond year round. When the first deals were coming out, these teams were responding to the floods in Kentucky, the fires in Palisades and Eden. This is the FEMA urban search and rescue program. Looking into the Forest Service and the federal firefighters, this state and the western United States depends so heavily on the federal firefighters. When CAL FIRE has multiple fires burning in the state, complex fires, 300,000, sometimes 1 million acre fires, the state is stripped. We depend on federal firefighters in the state of California and the western United States. It's not just California. California has a unique forest, a unique climate. Our fires are more intense. They're more intense because it's warmer, drier, larger timber than in other parts of the country. It's not just cuts to the federal firefighters and federal firefighting, but it's also research and development in the forest. Breeding trees that are healthy, that can survive the western pine beetle. If you have 10 million acre feet of dead trees in your forest, you're going to have 1 million acre fires every year. These are the things that we're watching today. These are the things that concern us today. And where it hits home for us is the municipalities have to strip their local entity to help CAL FIRE, the federal firefighters, put the fires out in the forest. And our forests today in the western United States, they meet the community. The wildland-urban interface, we talk about it, we call it WUI. We have people living in the wildland areas. We have to have help from the federal entities to stop the fires while they're small and not have 1 million acre fires.
Thank you very much, Chief, and thank you so much for your service. I'd like to have now Dr. Erica, I'm going to try this, Roshan Ravan, who's Medical Director for Community Care Olay, make her opening remarks. And I think you said I could call you Dr. Erica, right?
Yes.
Thank you. Dr. Erica?
Thank you so much, and thank you for having me. My name is Erica Roshan-Ravan, and I'm a family physician at Community Care Olay and the medical director at our clinic in Davis. Community Care Olay is a federally qualified health center, meaning we provide the healthcare safety net, or are part of the healthcare safety net for our communities in Napa, Solano, and Yolo counties. And we serve roughly 70,000 patients in those health centers with primary care, dental, perinatal care, behavioral health, substance use treatment, as well as care coordination and case management to help individuals access other services in the community and other benefits. Approximately 75% of our patients depend on Medi-Cal, and another 5% depend on Medicare. These are 56,000 individuals who are our friends, families, neighbors, and the majority of whom are either children or work as the backbone of our local economies, and this is in our organization alone. Due to the extreme proposed cuts to Medicaid, the proposed tax bill would be absolutely catastrophic for our patients, our health centers, and all safety net clinics across California. For the past 10 years, during the different waves of Medicaid, or Medi-Cal as we call it here, expansions, the rate of uninsured individuals in California has shrunk from 17% to 6%. And I have witnessed every day in my clinic what that means to these individuals and these families when they go from not having insurance to actually having insurance through Medi-Cal. And examples of that are access to medications, access to imaging services, specialists, access to surgeries, and really keeping people out of the emergency room and giving people more appropriate care early enough so we can help people not end up in the ICU as their first touch point with the healthcare system. Without insurance, I have seen patients come in after months and months of symptoms just to be diagnosed with late-stage cancers in the emergency room and then passing away before they could ever access treatment. Other patients are so often out of their diabetes medications because they cannot afford them that they suffer devastating consequences such as heart attacks, strokes, or loss of their kidney function or vision. This is devastating for these individuals and for their families, and it honestly breaks our hearts to bear witness to each of these unnecessary tragedies. With insurance, I have seen patients finally be able to access procedures such as fixing urinary incontinence that has been going on for decades, or excessive menstrual bleeding that was not able to be controlled before, or get early detection of diabetes or high blood pressure or cancers long before they cause any symptoms. Now, I suddenly have to look these same patients in the eyes every day and wonder what services they may still have access to, or what services we may be able to offer them in our health centers in the months and years to come. Let's be clear, our clinics are set up to see everyone, regardless of the ability to pay or their insurance status, and we will continue to do so. This is our mandate and that's our mission. However, nearly 70% of our revenue comes from reimbursements from direct patient care, and the vast majority of that comes from Medi-Cal. Cuts to funding would be catastrophic to our ability to operate. And the safety net clinics typically operate like ours with thin margins because all revenue is directly reinvested in staffing and services to care for our patients and our communities. If a fourth or a third or whatever the number may be of our patients lose the access to Medi-Cal and become uninsured, you can imagine that our revenue would similarly shrink by similar margins, which will be absolutely devastating to even the healthiest organizations. In healthcare, we use the term moral injury. It's often used in relation to healthcare workers, but it really refers to the moral distress that we would have when we know what's the right thing to do, but we have institutional constraints or the federal government making it nearly impossible to pursue the right course of action. We care very deeply for our patients and our communities, and we are very proud of what we do and for the comprehensive care that we can provide. And what we are witnessing here really creates moral distress for everyone involved, and not only because of the threats to Medicaid, but especially because of the threats to Medicaid and other programs for those who are most vulnerable. The healthcare workforce has already been absolutely exhausted and burned out. What we really urgently needed is more resources and a better healthcare system to have a healthier healthcare workforce, healthier patients, and healthier communities. The last thing we needed is fewer resources and complete devastation. Rolling back Medi-Cal is unconscionable, unethical, and outright cruel, especially taking into consideration what both Congresswoman Matsui and Congressman Thompson said, because it's completely unnecessary and will not balance the budget, but transfer wealth from those who worry about how to feed their children to those who really could not care less if another zero is added to their enormous wealth in their bank accounts. So I thank you for all the work you do and for having us here today to talk about this.
Dr. Erica, I thank you for all the work you do. Thank you so much. Now I would like to introduce Kate Laddish, who is one of Mike's constituents, wonderful person who I met before, and is a Medicaid beneficiary and chair of the Yolo County In-Home Supportive Services Advisory Committee. Kate?
Thank you so much, Congresswoman Matsui and Congressman Thompson. I really appreciate you having this event today. I am alive today because of care I've received through Medicaid and Medicare, and I am terrified about how cuts to these programs included in this bill will affect people like me who depend on these programs for access to medical care and other services. Treatment covered by Medicaid and Medicare most recently saved my life when part of my digestive system shut down. I spent 2.5 weeks in a series of hospitals and ultimately had life-saving surgery. Without treatment, I would have experienced an excruciating death. This is a recurrent problem that's required 3 extensive hospital stays, including in the ICU, and numerous trips to the ER. Taking away my care by cutting Medicaid and Medicare would consign me to a horrific, drawn-out, and needless death at home next time this happens. That's cruel and unconscionable. So I'm not just terrified, I'm also angry. I have several rare and significant musculoskeletal and neurologic conditions. Some are chronic, some have episodic acute flare-ups, and one is progressive. Some are readily apparent to others, and some are not. Since having to leave my beloved career and go on Social Security disability and SSI in 2009, the care I've gotten through Medicaid and Medicare includes covering essential medications, which cost significantly more than my monthly income, physical and occupational therapy to help manage the significant pain and help me hold on to the function I have, and treatment by uber specialists in my rare conditions, which has decreased the frequency with which I experience major and even life-threatening flare-ups. And you'll notice that I refer to Medicaid and Medicare. And the two programs together are really what keeps this boat afloat. Medi-Cal, as California's version of Medicaid, covers things that Medicare doesn't. And the biggest example is a custom powered wheelchair, which normally I'd use for something like this, but it's getting its wheel repaired today. And so I experience episodic paraplegia and quadriplegia due to one of my neurologic conditions, and frequent significant injuries due to another disorder. Without that wheelchair, there are days where I would not be able to move around even within my apartment, much less leave it. So I live on a little over $1,000 a month with Social Security disability and SSI, and that chair costs about twice my annual income. So there's no way that I could pay for it myself. Medicare doesn't pay for it. It's all Medicaid. So take away Medicaid, and necessary treatments and equipment like that rate become absolutely out of reach. Medicaid, through Medi-Cal, pays for other programs as well. In-home supportive services, or IHSS, is a great example. The goal of IHSS is to help people with disabilities and older adults remain safely in their own home or return home after institutional care by helping pay for authorized domestic and personal care services. To be eligible, IHSS consumers must be Medi-Cal residents and at risk of out-of-home placement due to a disability that's expected to last more than a year. IHSS is the most cost-effective way for people with disabilities like me to live in a safe environment. Defunding or cutting the program, which is what would happen with slashing Medicaid, will end up being much more costly because people will end up someplace more expensive or frankly on the streets. This would affect California's 815,000 IHSS care consumers, as well as the 700,000 IHSS care providers who would no longer have income. If Medicaid goes away, so does IHSS. And if people can't be at home, they normally move into institutions like nursing homes. But here's the catch. Medicaid is what pays for institutional care. And so all options would be cut off. What a bleak prospect. When the current administrative regime and members of Congress who support this bill promote cuts to Medicaid, either directly or through alleged policy changes like putative and unrealistic work requirements, it says to me that they don't care if Americans like me die, which is not an easy thing to say. But that's the bottom line. These cuts will result in needless suffering and needless deaths. But this grim future doesn't have to come to pass. I really thank Congresswoman Matsui and Congressman Thompson for speaking so clearly about the dire effects of this deadly bill and for bringing us together to speak of our experiences. It's difficult to talk about my health in such a very public setting and physically difficult to participate in a forum like this, but I'm willing to do it to underscore how important it is that the bill that passed the House does not become law. I also hope more people will share their own stories and will call whoever represents them in Congress and to say that they prioritize keeping their family, friends, and neighbors safe, healthy, and housed over giving big tax cuts to the rich, to corporations and special interest groups. And I hope that our representatives, congressional colleagues, will listen to that. Thank you so much.
Thank you very much, Kate, for your clarity and your passion. Now, I would like to have Diana Flores, who is the Executive Director of Nutrition Services for the Sacramento City Unified School District's Central Kitchen, make her opening remarks.
Thank you so much, and it's such a great opportunity and an honor to be here today. I'm here to raise the red flag about the proposed cuts to SNAP and Medi-Cal. How these cuts could have devastating consequences for student nutrition and food access. At first glance, SNAP and Medi-Cal cuts may seem like a household issue, but it's also a school issue. That's because SNAP participation directly affects whether schools qualify for Community Eligibility Provision, or CEP. Under CEP, schools with a high percentage of students directly certified for programs like SNAP, foster care, Medi-Cal, and homeless services can offer free meals to all students enrolled, no application, no lunch line stigma, and no barriers to access. Today, all of our 80 schools at Sac City Unified are CEP, and we serve 41,000 free meals per day to students. But when SNAP and Medi-Cal are cut, fewer families qualify for these benefits, and the ripple effect reaches our school cafeterias. Schools that no longer meet the CEP threshold must return to traditional meal applications where eligibility is based on a national household income scale used across all 50 states. And here's the big problem. Many families in California fall into a dangerous gap. They can earn too much to qualify for free and reduced meals, but too little to keep up with California's high cost of living, especially when it comes to affording daily school meals. For perspective, a family of 4 with 2 children and 2 adults, if they make $56,000 a year, do not qualify for free or reduced price meals. So paying for a meal would be $200 per month for 2 students, $2,000 per year. Thankfully, California is leading the nation in funding universal free meals for every student, at least for 1 more budget cycle. But this state investment is heavily supported by federal dollars through the programs like CEP. If SNAP cuts and medical cuts reduce the number of students who qualify for direct certification, the state's ability to sustain universal meals long-term is at serious risk. At Sacramento City Unified, these proposed cuts could affect up to 53% of our students. That means more than half of our students would face new barriers to accessing the nutrition they need, not just at home, but also at school. And when students are hungry, the impact is immediate and far-reaching. Social and emotional development suffers, attendance drops, academic performance declines. A healthy school meal should not be a privilege, it's a necessity and one of the most powerful tools to ensure successful outcomes for our students in the classroom. We urge policymakers to understand that cuts to SNAP and Medi-Cal aren't just budget decisions, they are decisions that weaken our educational system, our children's health, and their future. Thank you for listening today and your support.
Thank you very much, Diana. The thought of having hungry children really just frosts me. Really unbelievable. Thank you for what you do. Now I'd like to introduce Jess Bartholow, who is Government Relations Director for SEIU. Jess?
Thank you. Can you hear me okay?
Yes.
Great. Thank you, Representatives Matsui and Thompson, for hosting us today and for bringing together this whole panel. I've been so inspired and grateful to join the other panelists. SEIU, International Service Employees United International, is a union. It's the largest union here in California. It represents service workers, people who said couldn't be organized into a union, workers who were low income and had many challenges in their workplace to be able to join a union. Our union helps to pull together those workers who are fighting for their rights to unionize, to get good wages and health care, but also works on behalf of people in our communities, because our union is mostly women and mostly people of color. And we live in immigrant communities, here in this area, Representative Matsui, in your district, we have about 25,000 members, workers, people who work every day, pay taxes, and serve folks who are on in-home support services. We represent the people in the cafeterias who serve the food, who will lose their jobs when there are cuts as a result of this bill, if it's passed. We represent people on transit, people in the county offices. When we learn about the SNAP cuts, our workers also determine eligibility for SNAP. Here in California, we call SNAP CalFresh program. Mm-hmm. And that program is the most important anti-hunger program in the country. Can you imagine having a bill that cuts billions and billions of dollars from food for kids, cuts health care from valuable people in our community, takes away jobs? Representative Thompson, 15,000 members of SEIU work in your district. Their jobs are at stake. They're in addition to the 400,000 jobs you helped to create with your legislation on climate change mitigation and prevention. Here in California, there are 2.65 million healthcare workers. Mm-hmm. That's 14% of our workforce in California. And they're all at stake if a significant portion of funding is taken away because of this bill. So again, can you imagine supporting a bill, authoring a bill, promoting a bill, passing a bill that takes away food, takes away health care, takes away jobs, and calling it the big, beautiful bill, the audaciousness of these folks back in DC, they don't actually represent the values, not just of California, but of our country. Our country does not stand up for making kids hungry.
No.
In fact, the SNAP program and the school meal program are very popular among voters. Why? Because as Americans, we think kids should eat. We think our country's better off when kids aren't hungry. Medi-Cal is also very popular across Republicans and Democrats alike. And cutting it is very unpopular. Why? Because we value caring for people in our communities who need it and for when they need it. We create jobs with these programs, we create dignity with these programs, we create America with these programs. And back in DC, they have a bill that they call a big and beautiful bill that tears down what we know America's about. SEIU has been so proud to work with both of your offices and across the California Democratic delegation and the US delegation of Democrats to fight for this. We've loved seeing the unity of, among Democrats to fight for it. Across the state, we've been sending all of our resources to the members in the districts of the representatives who voted for the bill. And those workers have gone to town halls where they're not listened to. They've asked for meetings that they haven't got. And they've showed up anyway. Thousands of workers over the past several months have joined Democrats to fight against this bill, and we're not giving up. The bill still has to go through the Senate, and then it has to come back probably to the House, and we get some more chances to fight against this bill. We've already been able to take away some of the more harmful pieces. You know, and in labor and working in labor, you don't always get to work with the bosses. A lot of times you're up against them. In this bill, we are at the table with our bosses, with the doctors and the medical associations and the hospitals and the clinics and the school districts and the cities. We are fighting together against this bill as a united front for California. I'm so honored to be part of this fight, and I'm so proud of you and your hard work. Thank you. I look forward to the conversation.
Thank you so much, Jess. It's been so wonderful to hear all these opening comments, because it really does demonstrate the passion and the fact that we're all in this together, and each of the people here and even more represent so many billions of people. I mean, you think about it, it's really kind of one of these things where when you hear about the passion, you hear about the experiences, you hear what's going on, you cannot help but just stand up and be involved. We're gonna, Mike Thompson and I are gonna now ask a panelist some questions, and I realize that there's a lot of questions you want to ask, but we may be limited in some of the questions. But I want to start here with the chief here, because we are entering fire season, and we can tell already today is going to first 100 plus degree, and those of us who probably never dealt with fire before will probably have to think about it a lot more. I know that Congressman Thompson has already, but anyway, I want you to talk more about the fact that, what do you see here anyway? Because you are being called for almost every emergency there is, right? You name it, this is what's going to be happening. So I want to ask you one thing. If we're looking at, that really hurts the most vulnerable, this bill, and have impacts on every single one of us. But if Medicaid cuts force you to take an ambulance offline, or an ER closes, what would that mean for any Sacramentan who calls 911 or has a medical emergency? It could be a medical emergency, mental health emergency.
Yeah, all those emergencies, anything that we have to take offline or shutter because of lack of funding, is going to mean increased response times. And in our business, with increased response times, it leads to, and this is going to sound totally dramatic, but the worst thing that can happen is death. Any increase, 5 minutes we have to get to a CPR patient. In 5 minutes without oxygen to your brain, you're suffering from brain death. So we cover the city of Sacramento with 18 ALS medic units, and then a mixture of BLS and single resources, totaling 27. If we have to start shuttering those, it's going to increase response times. is gonna increase people's healthcare. For the simplest things too, it could be someone who needs a breathing treatment, and that's all they need, they just need help. Asthma is a thing in Sacramento. It's pollen season, it's fire season. We compete in Sacramento and California, fire season is the same time hurricane season is. We offer up firefighters, both for large wildland firefighters, or fires, excuse me. We offer up firefighters for hurricanes, and it's always earthquake season in California.
Yeah.
So when you look at the California Fire Service or public safety in California, we're on the line for everything. And when someone calls 911, we're there to answer that call. And it's gonna take us longer to answer that call without those services open for the public.
Thank you so much for everything you do.
Thank you.
Mike?
Thank you. I'll be brief. I just have two questions. As you probably know, and I know everybody in the audience knows, that in the last Trump tax bill, the ability of people to deduct in full their state and local taxes was capped at $10,000. In this new one, it looks like they're going to, as of today, bump that cap up to $40,000. But either way, it means less money for services that are critical, public safety services as well. Can you do more with less?
No, we have to do less with less.
I think that's important to note. And then you mentioned also the loss of equipment grants and the prevention funding. One of the good things that happened that this president did in his first term was the BRIC grants, the fire prevention grants that went out to different counties. And even though you're not in the middle of a forest someplace, you're impacted when there's a forest fire because of mutual aid, and all of you, all the departments show up to help when Americans are in trouble. So these BRIC grants went out, and I have two counties, Napa and Sonoma County, that got a total of $60 million in BRIC grants to do prevention work. They were taken away, they were clawed back. Is that just, you can just be real brief, smart policy or stupid policy?
Well,
I think that's a leading question, but.
Oh, I didn't mean it to be.
No, it doesn't help us at all. You have the Wildland Urban Interface Senior District, Congressman, and that's where we fight this the most. And those grants help us prepare districts like yours, districts around the municipal areas like Sacramento, but Sacramento's not safe either. You saw what happened in Eaton and Palisades. That can happen in the North State, that can happen in the city of Sacramento, and that's my concern as a fire chief. And it's those BRIC grants, the resilience grants that help us prepare for things like conflagration. That's what a fire department's here for today.
And we know the smoke doesn't stop at county lines.
No, it doesn't.
And we also know that inhaling smoke from fires is pretty toxic and can have, there's certain externalities that come with this that are very negative. Thank you.
thank you so much, Chief. We live that all the time, don't we?
Yes, yes, we do.
I wanna turn now to Diana Flores, because I wanna ask more about the cuts, the SNAP cuts, the food assistance cuts, because it's important, because the fact is that we get the farmers involved in it too. The local farmers who bring the food, and I went to a farmer's market the other day and saw the farmers coming in very early. And tell me about that too, and how that really helps the whole economy there for the small business people.
Right, so we were a recipient, we've been some recipients of local food for schools, some federal grants that were earmarked for local growers, and it's been wildly successful across the nation, where school districts are starting to look within their community and starting to source local, one, because it actually costs less, because it hasn't traveled. It's usually in season, tastes better, kids participate more in eating their fruits and vegetables, which is not easy to do. And we had our local foods for schools grant cut from us. It hadn't been awarded yet, so we don't know how much we would have received, but we estimate between $200,000 or $300,000 we would have received. And we do have a thriving farm-to-school program. We have about 45 growers we buy from. So we didn't buy as much from them. We still buy out of our budget, but we didn't buy as much because we didn't have the grant.
Thank you very much. I just want everybody to know this is really there's a whole economy based upon this too, so it's really very important. And also, you know, food is so fundamental to all of us here. And this, we've been, you know, raising the level of nutrition for young people and families. This is the greatest cut to food assistance ever. And you look about this country that we have bountiful fields and produce, and yet we're gonna cut? It's absolutely incredible. Mike.
Thank you. I'll be very brief. Thank you for mentioning the Farm to School program. I have a number of constituents who grow and sell to schools, and they're going to be hit hard. So it's not good for the kids, it's not good for the families, it's not good for the community, and it's certainly not good for agriculture. Could you take a second just to talk a little bit about the broader social and economic impacts of cutting these food programs? Everything from how well students learn when they're starving to the impact that has on the broader community.
Yeah, when I was thinking about what I wanted to say today, I have been at Sacramento City Unified for 18 years. I was here during COVID. We shut down on a Friday, and by Monday we had to be open curbside. We served 1,500 meals on Monday, and by Friday we were at 32,000. Food insecurity is real. People get scared when they don't have the resources that they once had. And school meals are a lifeline for families. So when they knew kids were not reporting to school, what were they going to do for their kids? So we do see kids that come in on Monday morning and they are so hungry on Monday because they haven't eaten all weekend. And it's true. They may have snacks, but they may not have had full meals. It's been our goal to have a dinner style meal at lunch because a lot of our kids do not get dinner. So it's far reaching, it's immediate. Kids cannot learn in a classroom when they're hungry. It's the most basic need that needs to be met before we can educate students.
Yeah, as I said earlier, it's shameful, the fact that we're going to do this to people who are food insecure and kids. It's just, kids are our future. We need to be doing everything we can to make sure that they learn the best that they can. They grow up to be productive members of our society. And I haven't seen it anywhere in the nutrition analysis, but in my district, I have one particular hospital that does a food program for people who are food insecure. And these healthcare cuts that we've talked about are going to devastate this particular healthcare provider, and it's going to have an impact on what they're able to do in regard to food insecurity programs. So people are going to get hit from all sides on this. So thank you for what you're doing.
Thank you very much. Dr. Erica, I think you covered a lot of territory, but I want to, you know, this bill really includes policies to reduce eligibility for Medicaid. And the more frequent eligibility checks and requirements for beneficiaries to prove they're working or exempt for some reason. At first glance, some of these policies may make sense to some people, but we know the policies in this bill are much more insidious. They're intended to create a web of red tape to make it near impossible for people to get the coverage that they need. Now, Dr. Erica, what do the red tape requirements in this bill actually mean for low-income families and people with disabilities trying to navigate their coverage? What would this do to their health?
I mean, it's absolutely clear that it's such a huge barrier that clearly is intended to kick people off the program. And because it is maybe easier to tell people, yes, you're eligible, but here are the conditions, than being frank and saying you're no longer eligible. But that's really what is happening, is that it's such a big barrier. None of us will be able to keep up with paperwork every month, proving what we are doing, let alone individuals who may not be English speakers, who have other barriers to accessing care, and who work long hours, often 2 or 3 jobs, who cannot keep up with that. We have resources in our clinics to help people access benefits and to fill out paperwork, and all those programs. Some of them are grant dependent and other things that are also being threatened, and it is really unconscionable to ask that, because the truth is that it's not a requirement to get people to work, because the vast majority does work, and those who do not, they cannot work. And the truth is, it is only intended to cut people off the service.
Absolutely. Can I just ask Kate to comment on this too?
Thank you. I thank you for what you said with that. Yeah, absolutely. When you increase paperwork, the intent is to cut people off. People who are already poor, if you have disabilities, the amount of paperwork that I do is tremendous. I live in subsidized housing that's for seniors and people with disabilities. I have an annual recertification. The file is, I measure it against my hand. It usually comes from the tip of my finger up above that knuckle up there. So it's more than an inch thick. That's yearly, that's just for one program. And so that's not including Social Security and the Medicaid, Medi-Cal, all of that. And so if something like documentation and having to do paperwork for work requirements was added in, it would absolutely be to knock people off. I lost my SNAP benefits because some paperwork came in. The type was very small. My vision gets affected with one of my neurologic conditions. Normally the form says, if nothing's changed, don't send it back. That time the form said, if something has changed, or if nothing's changed, do send it back. And basically it was the opposite. You have to take action. I couldn't physically read the form that time, and I thought it was the same form. And then 10 days later, I got something saying that those benefits had been terminated, and I couldn't climb that hill to get them back.
Thank you very much, Mike.
Thank you. Doctor, thank you for what you do. I'm a big fan of, go all the way back to when it was Clinic Olay. And my wife volunteered there as a nurse practitioner and was very involved in their funding and when they first started. And you guys do great work, and I really appreciate it. So if these cuts were to go through, I've had healthcare providers, hospitals, clinics, and everything in between tell me that one of two things are going to happen. They're either going to close the doors, or they're going to severely cut staffing in order to keep the doors open. So it's pretty obvious if the doors close what happens to the public that needs health. And the focus has been on folks who rely on Medicaid. But the fact of the matter is, if these facilities close and the other ones reduce their staffing, if someone who has good private insurance or is very wealthy and can buy their own health care, when they show up to the facilities that are still open, they just have to hope and pray that the surgeon that they need isn't one that got fired?
Yeah, that's pretty much there. It's healthcare access is a limited resource. It's already really limited. We already, especially in primary care, have not enough access in many areas, especially in our rural areas in California. It is really dire already, and like I said earlier, we urgently needed improvements and definitely not more further limitation on resources. And so yes, it will affect all Californians, not only those in Medi-Cal, because of the redistribution of services, and also because of increasing cost overall. If a very large and increasing number of Californians will start getting most of their care through emergency rooms, those are more impacted. They're already really strapped now, and that will just deteriorate for everybody.
So I have one of those rural districts that I have the honor of representing. I've had 2 hospitals tell me they close if this happens. One that's told me they think they close if this happens, but at a minimum they're going to really reduce their services. So this means if you become ill or injured in a rural area, you have to go further for health care. If you don't have preventive care through the facilities that are available now, you wait until you're acutely ill before you travel a long distance to get care, and that makes you sicker and more expensive to treat. Is that fair to say?
Yeah. Absolutely, yes, and I think, as the chief said earlier, minutes are lives, and that's also true for individuals traveling. For example, for obstetric emergencies, having to travel further is really devastating for the expecting person and their child, and for anyone who has life-threatening injuries to have to go further. And yes, it ultimately makes it more expensive.
And we've already said that the bill's been changed a number of times. I don't know that anybody's had a chance to fully comprehend everything. But I don't remember, and I read the bill, I don't remember seeing anything in the section on the healthcare cuts that exempts people from illness or injury if these cuts go through. Is that pretty accurate?
Could that be an amendment? That would be great.
So that means, and the healthcare providers that remain in business, they're not going to turn anybody away. If you become ill or injured and you show up, somebody's going to treat you. So that means greater uncompensated care costs, which in the long run are going to put those facilities that remain open in danger of closing as well.
Yeah, I think that goes back to the concept of moral injury, as I think the healthcare workforce is incredibly caring, including our leadership is very caring, and having to make those cuts, we will always be there and try to help as many people as possible with the highest quality possible, and seeing the discrepancy between what we know someone needs, where they live, where they're at, regardless of what their income is or their status, and what we can provide because of the resources given and the resources taken, is really, really hard, and it increases that feeling of moral distress and burnout in a healthcare workforce that is already really, really been strapped.
So this is more than shameful, it's immoral and evil.
That's right.
Thank you.
We were talking about a lot of things today, but I want to turn over to Jess too, because you brought in many of the fact of who really does help us and serve us, the workers that we don't think about too much and we really should. But I'm also thinking about some of these long-term care workers, when you think about people on Medicaid and all of that and who we depend upon. And I just want to ask you about what happens, what would the consequences be for long-term care if the Medicaid cuts are enacted, and how that would affect both SEIU members and the families they serve, because so many of this is, family care is a lot of this, but we depend upon the healthcare workers, and they're so fundamental to all of us that we really don't realize how important it is until something like this happens. When something happens and you get a call, like, do you know somebody who could help out, right? And so can you kind of expand that a bit there?
That's right. So Medi-Cal funds people who serve folks who are disabled, people who are elderly, people who have illness. It funds people who serve them in their homes. By doing so, it saves a lot of money, because it costs more to put somebody in an institution than to serve them in their homes. And this workforce is increasingly growing more skilled and trained. They are mostly women, and it's mostly work that women and women of color especially have been underpaid or not paid to do until recent years. In California, SEIU 2015 is the local that serves these folks along with United Domestic Workers in that union and in that organizing. SEIU 2015 has about 500 to 600,000 home care workers across the state of California. And if those folks are serving somebody who will lose Medicaid as a result of this, they will also lose their job. They're not you know, not a lot of money in the jobs. They're working for higher wages. They're working to get health care benefits with these jobs. But as you said, Representative, they're oftentimes a neighbor, a friend, a family member who, because of this in-home supportive services, which we call IHSS or home care, they're able to make that decision to do so. In the past, parents have had to say, if I can't get paid to care for my child who's disabled, then we will be homeless. And so the child goes to an institution. So this program helps people stay in their home and live with dignity and care that they need and not be institutionalized. It keeps families together. It's a family value program. So I want to speak to that. I also just want to say, because I think you know, you've all said it in different ways, but this is really about human dignity. When we talk about the cuts to anti-hunger programs or to Medi-Cal programs, we're talking about not harming people. Like, I myself grew up very poor here in Northern California, and I went without food as a child during those summer months. It is cruel to let a child go without food. I felt my body weak. I couldn't play in sports because I wasn't picked anymore. You know, those kinds of things that matter to kids, that build their self-esteem, and their future is taken from them when they go hungry. Doing the same thing to people impacted through the Medi-Cal program will also take away jobs. And in closing, I'd just like to say, when we think about the SNAP program, the cuts they're making are $300 billion, right?
Yes.
For every $1 billion in SNAP, it creates 13,560 jobs. Those jobs are, you know, work at the county eligibility office, but they also work at your grocery store. You talk about clinics closing, grocery stores will close too in these rural areas, in these food deserts. So these are job programs as well as humanity and family values programs. And thank you for the opportunity to speak about that.
I just have a quick point I want to make. I believe the amount's $330 billion.
There you go.
And the extra $30 billion, rumor is that's been added to provide subsidies for the farmers that he's harmed because of this tariff nonsense.
Yeah.
So just to be clear about that. On your workers, I think it's important, the point that you made, that they're going to lose their jobs.
Yeah.
Yes, right.
And,
It's not pro-job.
and a lot of your workers, because of their job, are able to have health care.
Right.
They're able to, if not as part of the job, they can purchase through the Affordable Care Act. They have access in that. So not only are they going to lose their jobs, they're going to lose their health care. And the idea that folks such as Kate would not be able to live at home and would have to go to a more expensive option, go to a facility or an institution, I don't know that that's particularly accurate, because those institutions are going to be harmed. They're going to be closing. There's going to be fewer beds available. Best case scenario, if they stay open, they're not going to be able to accommodate the number of people they're accommodating now. So this is greater than, sorry, you don't get to stay home because we're saving on the cost of a wheelchair. You go live in a rest home someplace. That's not going to be an option. I think we really need to be clear on that.
I think that's a really great point, and we also represent the folks who serve in those institutions too, and we are very concerned about what happens to people there now. People who didn't have in-home support as an option, and they're in those institutions now. Do we close the doors and just push the gurneys out onto the street? What is going to happen to those folks now? What will happen to those workers? And one last point, what you said made me remember, and when we think about the Medi-Cal cuts, you'll hear the Republicans in DC talk a lot about work requirements and this being a big part of the bill. And they'll say, well, you shouldn't get Medi-Cal if you don't work. Well, let me tell you, the pilots that they did on these Medi-Cal or Medicaid work requirements, they showed that the people who were cut off most were people who worked. Why? Because people who are working and low income, they don't have transportation, they don't have time, often working 2 jobs, taking care of their kids.
No
They
computer.
have obligations, no computers. They're being asked to, it's not just a work requirement, it's a work and report
Right.
requirement.
Mhm.
If you don't submit the report, guess what? No Medi-Cal for you. And you know what? Taking away Medi-Cal or food has never made anybody better at finding a job, keeping a job, or getting more hours at that job, and certainly doesn't make them better at getting more pay. And so they'll hide that fact. That Medicaid work requirement is a reporting requirement, red tape for working families, and will cut more working people off of the assistance than it will people who aren't.
Exactly. Mike, you wanna?
I'm going to ask a question of the good doctor. We're together again, yet another Trump tax bill, and we find ourselves joined at the hip. Your testimony was fantastic. It was very clear, very precise. You're clearly an expert in this, and it is a good example to all of us as to why this administration wants to disassemble academia. So thank you for being here. You were pretty clear on the distribution of these tax cuts, and as you know, in my line of work on the tax committee, the distribution tables, that's the coin of the realm.
Yeah.
Those are the charts that show us how every tax cut dollar goes. It's not disputable, it's not partisan, it's put together by PhDs and economists and CPAs, nonpartisan, bipartisan experts. And if you read those distribution tables, and you laid it out, people who don't need a tax cut in this environment get most of the money. And if you break it down on a per day tax cut, people over $1 million will get $223 a day in tax cuts. People under $50,000, 73 cents a day. The people on the low end are the ones that need it in this environment. So I have 2 questions for you. One, in your research and your experience, does that whole trickle-down economics work?
No. Not even a little. I mean, it's the, and you can see, to go back to say the big benefits given for investments. The current corporate tax rate is about 20%. So you get 20% back. Are you going to make a $1 billion investment because you're getting 20% back? Of course not. Do you like the 20%? Will you share it with your shareholders? Well, yeah, of course. It's a very nice thing. But you're not going to make the extra investment. And if you're wealthy and you get 20% back, you're just going to keep it in the bank.
Yeah.
So it just doesn't work. So there's actually lots and lots of research, but just common sense. It's just not a thing.
And a lot of the critics of those of us who have the beliefs that everyone's expressed today will have different responses. Everything from you're a liar to we're just going to cut the waste, fraud, and abuse. And we know that, I don't think anybody's lying about this. All the experts are singing from the same sheet of music. And none of us are for waste, fraud, and abuse. I haven't seen a lot of charges filed by the Musk and his Doge bros, so I don't know how much fraud is out there. But the other criticism is, well, of course, people who are rich are going to get a bigger tax cut because they pay more taxes. And this is probably I'm going to ask anyway, but is Congress capable of crafting a tax cut that provides a tax cut to people who need it without providing a tax cut to people who don't need it?
I mean, yeah. I mean, you just have to have an income cap or a phase out, of which there are very, very many things that Congress wants to do. So, for instance, with the passage action, which costs $800 billion, exactly as much as being cut from Medicaid, 95% of that goes to the top 5%. So you just have to have an income cap at $200,000. You get the tax cut, and we don't have any cuts for Medicaid. I do want to emphasize something, which obviously we're talking about big numbers, but also tiny numbers. I just want to emphasize that as well. So when we talk about $300 billion in SNAP, that's over 10 years. That's $30 billion a year. In tax world, That's a rounding error.
Yeah.
To give you a sense of how much of a rounding error it is, each 1% of corporate tax cost is estimated to cost $100 billion per year, right? That's 3 times as much every year. And the original Tax Cuts and Jobs Act cut our corporate rate from 35 to 21%. So, if we increased it just to say 25%, which is basically the international average, 4% more, that's $400 billion a year, no cuts, and we contribute to reducing the deficit. So it's important to understand that these numbers we're cutting basic needs for absolutely no reason except mean-spiritedness,
Yeah.
as far as I can tell.
And nobody asked for that 21% cut.
No.
No one asked for that. I'm on that committee. No one lobbied me. No one wrote letters. That was this administration the last time that did that. I had something else, but I'll get back to it. Thank you very much.
Well, I see our time has gone by really swiftly. I think this has been a great hearing, a great discussion, which many times we don't have. I'll tell you, in Congress, we don't have that many times at all. But I really want to say thank you to all our panelists. I think you've expressed yourself in the most authentic ways, and we really do appreciate that. And I think the public who sees this will see that too. You can say things that we can't say, or we don't have those kinds of experiences, but we can relate to it, and we can feel like it could be someone in our own family, right? You never know, right? We never know what the circumstances are going to be. So thank you very much for the courage to speak up. I know it's hard sometimes to feel, as you say, vulnerable, especially in front of a camera, but believe me, I think that more people ought to feel more vulnerable, understand that it's all of us here, that it can happen, whatever it is that we're trying to deal with now. We are not perfect. We are not people that can expect to go on with the rest of our lives with nothing bad happening to us, right? So we as legislators want to make sure that we try very hard to protect our community, our people, and have some sustainability and have a future. And one thing I know about this whole region, and Mike and I agree on this because we are, our regions are very close together here, that our community is strong. When we ask, you show up, which I think is so critical at this very moment, that we need to do that. I mean, we talk about a lot of these programs, but they're just not numbers. They're just not on spreadsheets, and that's why this is so important, because you can hear from the people who really can talk about it and talk about their experiences. Keeping our neighbors healthy and fed should not be political. None of us believe that's political at all. And they shouldn't be messed around with because of tax cuts that are unnecessary, absolutely unnecessary. And at the end of the day, Donald Trump and his congressional Republicans will have to look at themselves in the mirror and decide if they're for the American people. They've not demonstrated that yet. It is up to us, I think, to really stand up, all of us together, stand up and say, no, we are with the people, and the people are standing up with us. So we'll stand up with the small businesses and everyone else here that really are so important to us, with the people who work in the community health centers, the people who are here serving us all the time, the people who are in the grocery stores, the people who help us all the time, help our loved ones care for themselves, the workers, the healthcare workers. I mean, people who are with us every single day. They serve us and fight for us. I look at the chief over there who is really concerned about this season because he's looking at those cuts right in his face. And they're going to do everything they possibly can to make sure that all of us are safe. And I want you all to know that Mike and I will never stop fighting for you. That's who we are. And we will not stop speaking up for you. Right now, I think we all want people to say, hey, it's all of us here together. we all need to stand up. We all need to move forward. We all need to say, hey, this is for my kids, my grandkids, the people around us, the people we love, our community, to keep it safe, to keep it sustainable. And also the fact is that I know for Mike and me, we have grandkids. We look ahead to all of that too. We want to make sure that they have a future. A future. We can't let them down. And that's why I believe all of us are going to be united to stand up. Mike?
Well, Doris, thank you. And again, thanks to all the panelists. Thanks for everyone who came today. Doris is spot on. This is about the future. This is about future generations. And this is about a terrible injustice that we need to make sure everybody understands and understands the impact of what they are trying to do. So, as Doris said, we'll fight this thing to the death. And we need all of you to do the same thing. You know, you all have friends and colleagues and relatives in red districts. Call them. Tell them how bad this is. And speak up at home too.
Yeah.
Make sure all of our neighbors know how bad this is. This is a fight that's worth fighting because, as I say, this is for all the marbles. And I want to just circle back on one tax provision. You know, this tax bill provides an incredible windfall to people who don't need it. And there's ways to use the tax policy to accomplish good things. I don't believe unnecessary tax cuts are the way to go. I'm a big believer in using the tax code to enhance investments in things that you want to do. And if you juxtapose what these guys are doing, and Professor, I think you will agree with this, against what we did when the Democrats were in control, and we did so much in the tax space in the Inflation Reduction Act. I already mentioned the green tax credits, 400,000 jobs, $400 billion of investment. And the thing that doesn't get talked about too much is we also did an enhanced child tax credit that cut childhood poverty in half. In half. There's not a person in this audience who wouldn't be proud to be able to say, I cut childhood poverty in half. And we did it by using the tax codes. And we didn't do it by giving a tax cut to people who were extremely rich and the Elon Musk billionaire donors. So there's ways to use the tax code to accomplish good things. This is really misplaced. And this is going to hurt Americans, and we need to speak up about it. And we need to make sure all our friends, neighbors, relatives, enemies, critics, adversaries, everybody knows exactly how bad this is. So thank you all. Doris, it's always an honor and a pleasure to fight with you for what's right, and I know we'll continue to do that.
Absolutely.
Thank you all.
Thank you all very much for being here. Thank you.
Thanks, sir.